We continue with the window of heaven points, REN 22, heavenly prominence. Location, 0.5 June superior to the sternum in the center of the suprasternal fossa. How to find this point is best located with the patient in the supine position and a pillow under the shoulders or seated with a comfortable and safe head support. Locate the center of the suprasternal fossa approximately 0.5 June superior to the sternum, and there locate REN 22. Needling initial vertical insertion 0.2 June in order to penetrate the skin. Then direct the tip of the needle inferiorly and continue to insert the needle parallel with the posterior aspect of the sternum up to 0.5 to dangerous point. Wrong insertion technique, for example, vertical or oblique retrosternal needling, may lead to injury of the big vessel and organs inside the big mediastinum. This point should only be needled by experienced practitioners. Action indication: descends counterflow lung chi, alleviates coughing and dyspnea, benefits the throat. Special features: meeting point with the yin wei mai, window of heaven point, important emergency point for acute asthma attacks. REN 22 stimulates the descending of lung chi and is widely used in both acute and chronic cough and asthma. It resolves phlegm in the throat and lungs and promotes the expelling of sputum. It is used in acute situations such as acute bronchitis with profuse sputum or chronic retention of phlegm in the throat. REN 22 is an important local point for problems of the throat and voice. It stimulates the descending of lung chi in cough, wheezing, breathlessness, rattling sound in the throat. It resolves phlegm in the throat. It benefits the throat and voice, feeling of obstruction in the throat, ulcers, swelling in the throat, dry throat, hoarse voice, sudden loss of voice, goiter. In common with many points of the concession vessel, REN 22 has a strong action on descending chi. Located in between the lungs and below the throat, its principal application is in the treatment of a wide variety of disorders affecting these two areas. REN 22 has long been recognized as an important point to treat lung disorders. For example, the essential questions recommend it for rebellious, inability to breathe, and shortness of breath. Like other points suited in the uppermost position of the chest, lung 1, REN 22 is principally used to treat excess patterns characterized by upward rebellion of lung chi, including cough, asthma, sudden dyspnea, inability to breathe, and lung abscess with purulent bloody coughing. As far as throat disorders are concerned, REN 22 may be used in virtually any clinical situation, ranging from dryness, cold sensation, swelling, and pain, to Plum stone chi and severe ulceration, which prevents heating. It is also an important point for disorders of the voice, including cracked voice, loss of voice, and inability to speak. In modern clinical practice, the most common application of this point is in the treatment of wheezing and asthma, especially when accompanied by accumulation of phlegm in the throat. REN 22 is a meeting point of the conception vessel with the yin linking vessel. The yin linking vessel ascends through the chest region, and according to the classical difficulties, when the yin linking vessel alone is diseased, it will cause heart pain. REN 22 is specially indicated for obstruction of chi with heart pain and pain of the heart and back. Finally, REN 22 is one of 10 points listed in Chapter 2 of the Spiritual Pivot that have come to be known as Window of Heaven points. For a fuller discussion, so you can check that page. It illustrates many of the characteristic action of these points in its ability to treat goiter, rebellious chi of the lungs and stomach, and sudden onset of disorders, sudden loss of voice. The windpipe is like the chimney of the upper jaw. This point lies at the bottom of the chimney, but movement needs to or in both direction. The neck is a bridge to heaven. You are entering transitional territory with this point. With the in-breath, ability passes this point, and when this point is needled, chi rushes forward. When a person feels disconnected from their heaven, physically or at the level of the spirit, they can appear remote and stultified, oppressed, all senses dull. Without the free flow and animation of heavenly influxes reaching the upper dantian and the home of the heart, the individual, they find no authentic communication within themselves or with others. This point allows the free communication of spirit and chi, helping bring refreshment to the spirit and a new perspective on life. It clears blockages and refreshes the senses. It allows the passage of the old blood and liquid that travels in the throat, as well as needling celestial chimney to revitalize the senses and spirit. It can also be used when someone's window seems stuck open and who are lost in their own ungrounded perceptions. The lung rules the truth and strength of the voice. The heart will burn speech and the tongue. Red might process here with yin wei mai. Red mai controls the yin, and yin wei mai preserves and maintains it. Yin wei mai meets with red mai at 22 and 23 and passes to the top of the head. When yin wei mai is disordered, there may be pain in the heart, loss of will, and depression. Renmei and yin wei mai nourishes the heart by restoring the yin essence and blood needed to stabilize the heart. So its proper relationship with the spirit, its communication, the command, the sampu can be resumed. Regulates the lung, strongly promotes the descending and diffusing of lung chi, moves stagnation of chi, transforms phlegm and promotes expulsion of phlegm, clears lung heat and moistens the throat, restores the voice.